Hello, people. I guess I should mute the TV. We have basketball slash the election on. I am sure many of you are watching the election results as they slowly come in. But let's take a little break, maybe. Talk about some nursing school med math. I, for one, hate math. I'm not very good at math. And for those of you that aren't in nursing school, and you guys like my NRSNG shirt? What? Just got this today. But so I'll talk. So nursing school med math is challenging, but it's very, very necessary. So, and I don't know how y'all have it, but my nursing school, keep in mind this was a little while ago, but it was like every semester we had a math test. Yeah, I was going to let you know, John, the shirt got here in time for Facebook Live. What? So yes, John just sent us one. So, but med math is challenging, but in nursing school, the way that it was set up for me, and I think a lot of schools are very similar in that every semester I had a a med math test, and you had to get, what was it, a 96 or above, and it was like a 25 question quiz, so whatever that works out to be. I think we could only get one question wrong, and if you did not pass that test, you failed the semester. And my school was small enough where you couldn't take that same class again next semester, like you had to wait a whole year. So needless to say, you could get like this A plus in the class, but if you didn't pass these math tests, you were screwed. Yeah, it's kind of a big deal. So, for those of you that are not great test takers, me. For those of you that are not amazing at math, me. Those tests were like the worst part of the year. Like when I got done with that for this semester, I was like, oh my god. So, and halfway through nursing school, a friend taught me a good little trick that I'm going to go over with you. But also, before I go over that, I just want to, as a nurse that's worked for 6 years, I think there have been, there's a few things, like, the nursing med test, they want to prepare you for everything. And there's some decent stuff on there that's like, no, I legit use this all the time. Like, I use this all the time. And so it really is important information that you're using. Now, the whole, like, you'll never have a calculator thing is kind of like, in the world of smartphones where you always have a phone in your pocket, so someone is saying theirs are 10 questions and they have to get 100 or you fail. Yeah, I'm pretty sure it's like, y'all better get all this right or you're not going to pass. And so that's basically what, nursing med math was. And so needless to say, no matter what nursing school you're in, you're going to take them and it's going to be really important. Okay. But just reassuring you that it is, like, it's not just, like, something you take in nursing school that's, like, getting through. No, you really do need to know it. And I actually was, like, we've been working at NRSNG on some math resources because they're it is kind of tough. So I was researching some of it because there's a few things I use all the time. There's like 2 things, and I'm actually going to go over them. The 2 things I use all the time. And then I was looking up like, I forgot about drip rates. Y'all have to learn like drip rates. And I was like, this is ridiculous. Like, why does anyone have to do this? And I tweeted about it, kind of complaining a little. And a bunch of people responded saying, no, actually, I am a nurse working at the bedside right now, and I had to do it the other day. We ran out of pumps. They had to have it emergently. I had to look it up, and I did it, and it was, good to know. Had some people say, I don't know if they were nurses, but like out in the field, they were using drip rates. And, I recently did an interview with a flight nurse, and I didn't ask her that, but I could see in transport that being utilized. So drip rates, even though they're annoying, and most likely you're not going to need them, out of 100, however, you're probably really not going to use it that often. But it's good to know, and good to have a little experience, or at least be exposed to it, so it's not like, what the heck is a drip rate, Because rarely in the inpatient setting are you running things by gravity like that. So that's reassuring. Another thing I want to reassure you about is you don't have to be a mathematician. Like, I was like, oh man, you have to know so much math to do this. And in the reality, there's some basic key concepts. If you can really master excuse me, those basic key concepts, you'll do fine. You will do fine. They are not, they may be a little difficult to kind of understand at first because you're not used to dealing with stuff like that, but you know, you get used to them, you get routine with them. Right, I had a pump go out on me on an ambulance and I was able to figure it out. Great. See, like that's an example. Like that happens in real life nursing. Like it's important to know. So, you know, you don't have to know like calculus and geometry and all this crazy stuff, but you do have to know some basic key concepts. You will get used to them. They will get easier, and it's totally doable. Remember, you are in nursing school getting exposed to it for the first time. Of course, it's a little bit much, right? Okay, so my tips for nursing school math. Number one, when you're sitting down for your math test, like I was someone that was like, okay, I have to memorize the basic formula, like volume over time times the drop factor. Like I have to remember that. And so what I would do when I would get my test is I would quickly write those at the top of the page and make sure they were right before I even looked at a question. I would write those at the top of the page. That way I knew when I had a question, I wouldn't have to try to recall that information. I could just look at where I wrote it and know that was right and take my time and not stress about remembering it correctly. So I encourage you to do that if there are equations that are difficult for you to remember, you know, where does the volume go versus the time, or maybe, you know, I have trouble remembering there's 2.2 pounds in a kilogram or whatever. Write it at the top of your paper at the beginning of the test, and then you know it's there. You're not screwing around, you know, and that eased my anxiety because I would like not. You know how you're like, oh, I'm studying for a test, I gotta remember this and gotta remember this. Well, if you quickly write it down at the top, then it's like, okay, it's there. I trust that it's there. I don't need to like strain to remember it, because that distracts you. Other tip, when you read the question, understand what they're asking you for and focus on that. There are a lot of distractors typically in those questions, and it's really important to look at what you have. What are they asking you for? Are they asking you for milligrams, milliliters per hour, kilograms, whatever? Like, what are they asking you for? What are you given? And then converting your units the way that you need to. You know, I remember in school there were a few things I had to memorize. Now, honestly, pounds and kilograms, y'all better get that in your brain. That is real life nursing. You gotta know a lot of, you know, I mean, a lot, and even when you're in adult nursing, there are weights that are, or I'm sorry, there are weights that are weight based. There are drips that are weight based. Not a whole lot of like routine meds are weight based, but like a lot when you're getting in the ICU, you're getting in the drips and that kind of stuff. A lot of those are weight based. So it's important to know kilograms. There's 2.2 pounds in a kilogram. You know, like those kinds of things. There's a few, I remember I had to memorize like ounces and milliliters and that kind of stuff. I don't know. That stuff's important to remember, but those kinds of conversions, if you're having trouble remembering those, make sure you get them at the top of your paper when you sit down to test. Okay, so I'm going to go over a couple, so I want to show you, this is like the thing that when someone showed this to me, it blew my friggin' mind, guys. Okay. So the biggest, most consistent problem. Now, I'm not going to talk about unit conversion. Like, memorize the unit, convert it. Like, I'm not going to go over that really. But this one thing that was showed to me like halfway through nursing school made the rest of it way easier. It's called do-da. Do-da. Remember, do-da. You guys got that? What was that? Do-da. Okay. What does do-da mean? Do-da, and actually, I was going to have my husband hold it, but maybe, I wonder if I hold it up, will it be backwards? Oh, that's probably backwards. Okay. I actually got out a notebook that I had in nursing school, believe it or not. I actually had taken out all my nursing school stuff, but, so dose ordered over dose available times amount. I'm going to say it again. Oh, and you guys see, I don't know if you guys saw on my Instagram, I cut open my hand. Okay, y'all, Sunday I was making chili. I was really excited to make crock pot chili, and I cut my hand on the can, and I have 6 sutures. And I can't wait to take them out. They're driving me nuts. I can't type very fast either, which is also driving me nuts. So dose ordered over dose available times amount. Okay, so I wrote, because I wanted to give you guys an example. All right, actually, John, can I snag you for a second? John's going to hold the thing so you guys can kind of see my hand. Say what's up, John.
Hey, what's up?
Like that shirt? Isn't that a nice shirt? Okay. Oh, wait, yeah.
Switch it.
Maybe. All right. So, and forgive me, my handwriting is kind of crappy because I can't really move my hand super great. So, dose ordered over dose available times amount. If you can just, actually, wait, no, keep it like that because I don't think it turns, yeah, here. So if you can just keep that in your brain, dose ordered over dose available times amount, that'll help you get most basic drug calculations. So I got 2 examples. I didn't want to do a ton. So let's say, Mac wants to say, hey Mac, do you need any help with your math skills? You're so dark. It's hard to see you. So let's say I've got this order. Hold on, let me cover this up because.
Yes, that is a beer.
Cheers. Sam Adams Old Fezziwig Ale is pretty good. Okay. So I'm ordered to give 0.5 milligrams of Dilaudid, but it comes in a 2 milligram syringe. 2 milligrams times, and the amount, and the way you remember the amount, I wonder if I can. The amount is typically it's the milliliters, times 1 milliliter. That doesn't look great. All right, who's got their calculators out? Because I guess I can't really do mine. I didn't even think about that. Dimensional analysis. I don't know what that means. Okay. Yeah, so this trick man, y'all, I'm serious. And I use Doodah at the bedside. For real. 0.25. Oh. Wait. So I'm going to give 0.25 milliliters. All right, let's do this one. And this one actually I do a lot. I give heparin bolus. Got a heparin drip. Maybe they got a PE. We're starting a heparin drip. They want them to have a bolus, and that's how much they want the bolus to be. So bolus, dose ordered, 8,500 units. So what's available, though, are 5,000 unit vials. So there's 5,000 units in 2 milliliters. How much am I going to give? All right, John, let me do that. Do you mind doing that math for me? While he's doing that, I'm going to just have this at the knife. So that divided by that times that. So I'm going to administer 3.4 milliliters. Boom, baby! I'm telling you. Oh, that's like bread and butter. Okay, if you're a nerd, because you can do the cross multiply thing, but I don't know. It's too confusing for me. I know it's basic, but it's too confusing for me. The other thing I want to go over real quick, but that one, y'all, I'm telling you, that is it. Doodah all day. Okay, the next one is, oh shoot, okay, drop factor. So I didn't get an example, but basically you're doing your mils over your minute times your drop factor. Pretty straightforward, guys. I'm not going to do an example because it's pretty straightforward and mil over minute time drop factor. Wonderful. Okay. Next, so that one, I'm not spending a lot of time on that because we, at the bedside, don't do that much. Okay, between Doodah and this one, those are like, that's like everything. Most, I can't say everything, most things. So a lot of the tests may have you figuring out milliliters per hour. And when they say milliliters per hour, we're talking, what are you going to program in your IV pump, basically? So we want you to infuse 200 milliliters over 1 hour. How many milliliters per hour are we going to run that pump? 200 milliliters in 1 hour, if that makes sense. All right, so let's say, though, we have 200 milliliters ordered, and they want it to infuse, well, let's see, maybe they want it to infuse over half an hour. So then you would put 200 divided by 0.5. And then, what is that?
Calculating.
See, the thing that I want to tell you guys too is, no matter how basic it is, if you're not 100% sure, even if you should know this, you double check. All right? So that's the thing. Thank you, John. I think that's all when I started in critical care, somebody, I was like, we had to do a math problem. I was starting some drip, or given a partial IV dose, and I wasn't, it was a really basic math problem, and I just figured, oh, she's a nurse, she'll get it off the top of her head. It's like she'd been a nurse for like 20 years, and she did it in her calculator, and it made me feel a lot better, like, okay, even if it's an obvious, easy math equation, I can, no matter how easy it is, I am going to do it on my freaking calculator because I'm dealing with medications. I'm dealing with patient lives. Like, what if I had accidentally done 200 divided by 5? That makes a profound difference, you know, and it can be very easy to do that. No shame in being thorough, or, yeah, technically maybe I should be able to do 200 divided by 0.5 real quick in my mind, but you know what? I've got a bunch of people watching me right now, and maybe I've got a patient in front of me that I've got to program their IV pump. I'm going to double check that in a calculator. You know what I mean? Like, I don't want you to feel like I should know this, so I'm going to make my best guess or something. I don't know. Oh, okay, yeah. Just heat up the barbecue and I'm making wings, you guys, and they're about to be done, so John's going to make the sauce. Melt a bunch of butter, throw in Parmesan cheese, Italian seasoning, and garlic. All right. Yes, I love that, Cheryl. No calculator shame. I don't care how obvious it is, y'all. Just get out your calculator. You're dealing with patient lives, like, absolutely no shame. Gosh, I thought of something, though. Let me look back. So remember, Doodah, dose ordered over dose available times amount. Y'all, for dinner, I'm making wings. I am making barbecue wing, half barbecue, half Parmesan garlic. I perfected how I bake my wings, by the way. I put them on a cookie rack, a greased cookie rack, over a cookie sheet. And then before I put them in, I put baking powder on it. It absorbs the extra moisture, and they're so, and then my sauce is melting butter, throwing in some Parmesan, and throwing in garlic and Italian seasoning, and sprinkling and tossing it in that, and then sprinkling Parmesan, a little extra Parmesan, and some parsley. Serious. Okay. So I think that, and that's what I remember. I know. You guys want to come over for dinner? The other thing, though, I wanted to say was, you'll get a lot of distractors. Actually, I pulled up an example. Let's see if I can do this. Okay, so let's say you get a question. Not allowed to use well, that sucks. That was one of the hardest parts about nursing school, was how do I do long division? Like, but rest assured, when understand that for nursing school. But when you get out there, you can use your calculator, and you should use your calculator. Okay, so here's an example question. Your patient has 2.5 grams of IV Vanc and 500 mils of normal saline to be given IV piggyback over the next 3 hours. So that's a lot of information. But the question asks, how many milligrams total will this patient receive? So while I was given all that information, essentially all that question is asking me to do was convert 2.5 grams to milligrams. And also, guys, that's important to know. Being able to convert between milliliters, liters, milliliters, and all that, and grams and milligrams, like, legit, it's important to know that stuff. Like, don't just learn it for school. Like, that's really, really helpful to know. So really make sure you're looking at what was I given, what are they asking for, and forget the rest. Like, answer the question that's being asked. Don't be distracted by the 500 mils of normal saline or how you're going to administer it or whatever. Like, what am I given? What am I being asked for? And how do I get to that? And forgetting about all the distractors, because those will be there. So if you can remember dosage calculations, dose ordered over dose available times amount, milliliters per hour. So just practically think, okay, it's 500 mils and I need to give 500 mils in an hour. Well, there you go, 500 milliliters in an hour. And if it's over half an hour, remember, just do the percent, like half of an hour is 0.5 of an hour, or over 15 minutes is 0.25, or, like that kind of thing. But typically it's either an hour or half an hour. Like I feel like I've given one med. Like IV Keppra sometimes is given over 15 minutes, I think that's probably the only med I've realistically put on an IV pump to give over 15 minutes. 30 minutes, an hour, 2 hours, that kind of thing. Fluff is what our instructor... I use a calculator every day for calculating creatinine clearance and double-checking chemotherapy doses. Yeah, Kiara, I love that. Pediatric math, any tips? So I don't work peds, and I don't remember much from nursing school about that, but from what I remember, though, it's all dosage calculation, it's all like weight. Everything was weight-based. So memorizing the 2.5 milligram, or 2.2 pounds in every kilogram, that's going to be your bread and butter, making sure you know that, because you're probably always going to have to convert from pounds to kilograms first. Get that taken care of, and then go to your next, and then deal with the problem like a normal dosage calculation, doodah, or whatever. But that's the main, and if anyone else has tips about peds math, please put that in there. I honestly can't remember too much about it, and I don't want to speak too much on it because I don't remember much. And if you have any questions not related to math, that's fine, because again, math is not my strong suit. I just told you everything I know. That's it. That's all I got, guys. But that's all I need. I love nursing math. It makes me feel like I'm good at math. Yes. I mean, it does feel kind of cool to be like, oh yeah, I'm going to use this much vancomycin over this, I don't know. It feels kind of cool. Let's see. I thought there was got my IV meds calc, not allowed. Oh yes. Okay. So I looked at that one. I think that was any questions. If anyone has questions, please put them out. That was I knew this was going to be probably a little bit of a shorter one because, med math is kind of straightforward. We realized how stressful it can be, though, so we've created a bunch of posts. We created a large resource post that we're still tweaking, and even a mind map kind of thing for visual people, but we're still working on it. Oh, thank you. We got a Sam Adams sampler pack of beers, and they're really good, and I'm really impressed with them. So we created a bunch of stuff because we know how annoying nurse math is, but truly some of it is really, really important to know, and you can use calculators in real life, and you very much should if you have any doubt at all. There is no shame. Don't pretend you know anything. Make sure, and if you ever have, in real world nursing, legit questions or concerns, call the pharmacist. That's what they're there for. I call them all the time. You want to utilize your resources to make sure you're doing the right things for your patient. So there's no pride at all. No, don't be prideful at all. Understand what the dose you need to give for your patient. And honestly, what I've real life too, most things come in one tab or two tabs or one full syringe or something like that. So if you're giving a partial dose, typically when you scan it, it tells you, hey, you got to give a partial dose. And then maybe it'll tell you. Most likely it tells you in the computer how many, milliliters or whatever. And I just double check it real quick with my math. And then if my math matches the computer's math, I feel good, especially if it's not like a big alert medication. But if it is, then I double check it with another staff member, and they double check stuff with me. And most of us are bouncing math questions off of each other, so there also is no shame in that at all. So calling the pharmacist all the time, like you're given meds. You want to make sure you're doing it right. So if you have a question or at all, you double check, So guys, what questions do you have? It's your license and the patient's safety, ultimately. And this is one thing I thought of too, when you're talking about milliliters per hour and all that. Hospitals, which the kind of the trend now, which it is newer, but I really like this, is physicians order medications, IV medications, to be given over a certain amount of time. Infuse vancomycin over 3 hours. Infuse Zosyn over half an hour or 4 hours. Or infuse this liter of saline over 4 hours or whatever. So, like some of the latest pumps and the technology is you plug in how long the physician said this is supposed to go in over, the duration, and then it auto-calculates the rate, and then you can just double-check it, as opposed to just plugging in the rate. It's just another safety check, which I think is pretty cool, because I feel like that's how we should be thinking. We should be thinking in duration. We should be thinking in the way that it is ordered, and not trying to think like, oh, what's the rate? I don't know what the rate is, if that makes sense. I think that's kind of that might be the trend with the newer pumps. But it's nice too, safety-wise, if you're hanging a drip, or even if you're hanging IV meds at all. A lot of the newer pumps have you program everything in. So it kind of, you're infusing 3.75 grams of Zosyn over 4 hours. It's in 100 milliliters. This is the rate that it'll be at. And it just, you put in the order and it calculates the rate, and then you double check it. So I think it's pretty, pretty cool. Now I want to give you guys a little time if anyone had any questions. I know it's kind of straightforward. Usually people have some more questions, so I'll kind of hang out a little bit. People watching the election, I'm assuming we're going between the Cleveland-Atlanta game and then the election night. So if anyone has any questions related to nursing math, related to anything nursing, feel free to put them up. I'll give you guys a couple minutes, and then we'll say goodnight and see who wins this election. Do you program your pump to beep before the fluid is done? Yes, that's a great question. I do that, yes. So if I'm hanging a liter of saline, I typically program 975. 925 or 900. That way, if it beeps, I know I've got, actually, it depends on the rate. So I will typically give myself an hour of leeway. So I'll program in the pump an hour, for the whole thing to go in. If I'm giving continuous meds, but if I'm giving an IV piggyback, I want the whole thing to go in, and switch over to the main line. So I will program, so it'll beep, so it'll let me know, because I want to be able to push silence a couple times, or have one of my coworkers push silence a couple times, just in case I can't address it immediately when it starts beeping, because that frequently happens. Oh shoot, their fluids are dry, I'm in the middle of starting an IV, or I'm in the middle of grabbing labs or passing meds, and I can't just drop it to go get a new bag of normal saline, So I like to give myself about an hour, kind of to let me know to go in. That's a great question. And just to encourage you guys too, it was really hard for me at the beginning and I was telling my one of my good friends now, who originally precepted me, how she precepted me when I was new to critical care, but when I was a new grad. It was really one of the things that was really hard for me to get my mind around was primary and secondary tubing. I don't know why that was so confusing for me, and I felt like such an idiot. But I couldn't get it, and it took me a while to understand how to prime them and how the gravity and all that kind of stuff, like that was confusing to me. And then, so I got that as a new nurse after a little bit, but then when I started critical care, what was confusing to me was priming an arterial line and priming an extraventricular drain and EVD. Like, I don't know why that was just like, oh, why don't I get this? So that was kind of challenging. So, but you know what? Whatever. As long as I learned how to do it, it's fine. And it took some time, and just because I didn't catch on the first second doesn't mean I'm not like this amazing nurse or something. You know what I mean? Like, so just want to encourage you guys with that. So I haven't seen any more questions come through. Oh, when you're giving a med, say Zofran IV, do you time how fast you push when you're giving the actual med or when you're flushing it with saline after? Both. All right, so Zofran is typically 1 milliliter or 2 milliliters, and if I am giving it IV push, you doing okay over there? You sure? All right. I usually make this sauce, and I'm like, oh no, the wings are gonna be done when we're doing Facebook Live. So basically, when you're pushing that med, 1 milliliter, 2 milliliter, like you need to push slowly, pushing the medication in. And most meds are 2 minutes, pushing it over 2 minutes. Zofran is really important because it can, lengthen your QT. John, that's a pet peeve of John's, is people just slamming in Zofran. It elongates the QT interval, I think that's what it is. No, like if you slam in Zofran, that's a big deal because you can legit kill somebody with that. And it's such a common med. So you want to make sure you're pushing it in over 2 minutes, but then including that flush with the saline. Because really, like a mil, how much, that's not very much in an IV when you're talking about like that much of a diameter and that much mils. Like you want to push the med in slowly and then the flush slowly as well, because just think about it practically. Like if the IV is here, it's 1 milliliter of solution, and you slowly push it in here, so it slowly goes here. Widen your thank you, Susan. Zofran can widen your QRS complex. So you push it in slowly, or you push it in here. Well, it's got to get all the way up to the heart to get diluted in the right atria. So if you push in push it in, and then slam in your flush, you're just, as opposed to slowly letting it get up there, if that makes sense. So you really do need to flush slowly as well. So don't just think, okay, I can't see it anymore, I can slam in a flush. Like, no, you need to push slowly as well. But that is, Vanessa, great question. Really, really great question. Jessica, terrified to be a new nurse. Me too. It's terrifying, but it's okay. You'll figure it out. We're here to help you. You'll be fine. You just, make sure you're double checking and being safe, but you'll be fine. How do you get over the fear of having a physician yell at you when you need to call them about a status change? Okay, you got to just make sure you got the right information, you anticipate their questions, and you speak confidently and firmly. Like, okay, you can yell at me, whatever, but this patient needs blank. Regardless of whatever, this patient's status has changed, and you need to know about it. Like, there's no, and then if they start getting sassy with you, hey, you can talk to me whenever you get professional, we're going to talk about this, but you will not speak to me disrespectfully. It's like, you got to find that confidence and that, like, hey, I am calling you for a legit reason. I'm not just calling you because I want to. Like, I don't really want to call you at all, but I need to because the patient needs it. And honestly, the best, I think, reassurance or whatever you can provide yourself is, as long as I'm doing whatever's best for the patient. Like, if I need to let the physician know about a status change, then I need to do that because it's what's best for the patient. And that was one of those things that I would remind myself when I'm calling a physician that's a little grumpy or whatever, or rude. It's like, true or false, the physician needs to know this. True. All right. Hey, I'm calling you to let you know blank. All right, bye. Like, and I'm not going to take it personally. I'm not going to whatever. I'm going to demand respect. They're going to speak to me with respect. And if they can't, I'm going to hang up. Let them know they can call me when they, and usually if you say something like that, they kind of chill out. But yeah, that's really, it's tough. That is tough. Still working on my prereqs, and I'm on my last hard sciences before going to university. How relevant is micro to what is being done day to day? When you're doing practical, tasky stuff, you don't really think about it, but truly micro is relevant. We did a great blog post. Susan, John, or Heather, if one of you guys have a second to put the link to that. So how tough is nursing school really? And we talk about the importance of micro. Gram stains and antibiotics and resistant organisms and that kind of stuff. It really does. It's important to have a baseline understanding of that stuff before you take care of patients. Just the way that stuff kind of works. Because I call micro, there's a micro department as part of the lab, and they'll call you and say, hey, this patient's got a resistant organism, or has got this, or has got that, and you have to have some sort of an understanding about it to have a educated dialogue with the physician about it. So yeah, it is important. It is, definitely. I mean, you're not going to remember all the nitty-gritty little details, but to have a baseline understanding of micro is important, yeah. How much math would you say is in the NCLEX? God, that's a great question. I don't remember. If anyone has, like Susan or anybody, do you guys remember how much math was on the NCLEX? I think basic dosage calculations, I think, would be, but I honestly don't remember enough to answer that. Oh, thanks, guys, for putting those links. I'm taking micro. Agreed that it's good to have a baseline, but we also are learning how to fill out requisition forms. What's a requisition form? I don't know what that is. What are your thoughts about working 2 12-hour shifts on the weekends while in third semester, or even working during the final semester when trying to do clinicals or preceptorship? Man, Jody, that would be tough. I don't know how you get that done. Man, and so the end of nursing school is studying for the NCLEX, trying to find a job, and studying for finals. Yeah, okay, thank you for answering that test question. So that's the hardest that's the busiest semester. You've got to get your clinical hours in. You've got to get ready for a job and apply for a job that last semester. There's a lot of stuff to do. That would be stretching, I think, unless it's absolutely financially necessary, I would try not to do that. That's a lot to do. So if you're in a place financially where you don't have to do that, that would probably be better, so you can really focus. But if you got what you got to do, that's my thought. Susan says, and Susan is an NRS&G team member. I had very little med math, but it can vary depending upon what you get. It's different for every person. Yeah, So it's like you get a question, and then if you answer it right or wrong, and so it is very dependent on each person. Did anyone else have any questions? Yeah, those are good, very, very, very good questions already. Otherwise, y'all, I might sign off. I just watched The Crown on Netflix. I really liked it. And I'm watching Glitch now. And I'm really liking that one. Just so you guys, in case you guys were wondering what I'm watching on Netflix. And I had some Office on in the background today, like normal. What was today? Women's Appreciation. When you start your shift, do you do a full head to toe on each patient or a basic assessment? Oh, wow, look at all these. Okay. When I start my shift, everybody gets a head to toe. When I go in and get a report, if I need to do a quick neuro exam, I will, with the night shift nurse there. But I introduce myself to the patient, and then when I know I have a second to be in there and do a full assessment, everybody gets a full head to toe, yes. Oh, I missed one. Hold on a sec. I work 2 days a week in third semester. It's very challenging. I won't be working 2 days during level 4. Yeah, man, that's. I don't know. I don't know if that would be why. Yeah, I would think not working on the weekends, because you got to have some time to like relax a little. The Crown was awesome. Yes, wasn't it? I want to watch it again because I was only kind of half paying attention, but I really loved it. And then I looked up all this information about the royal family. The dean of our program said they've made changes to the NCLEX regarding the names of meds and questions. Interesting. They will no longer be. Oh shoot. They will no longer be using trade names, generic names only. Boo. That sucks. Because the trade names are a lot easier to remember. That sucks. I start nursing school this upcoming January. Did you work during your first semester or did you get the feel of things first? I actually played basketball in my first semester and immediately regretted it and then decided, hey, I'm going to get a job after I quit basketball because I didn't have enough time and I thought the job would be less of a time commitment and then I quit that too. It was too much. It was too much. For me, it was too much. So I personally believe if you do not have to work to survive, during nursing school, it would be best to focus on nursing school. And some people are in that position where they don't have to work during school, and I think that's wonderful, and I really think that's ideal. But if you have to work, you have to work, you know. So if you can help it where you don't have to, I think that's best. I ended up junior year tutoring once a week and made just a little bit of money doing that. So that was what I did, and I felt like that was enough. Where I was doing something, but it wasn't too much of a commitment. Where I felt like overwhelmed with nursing school. Let me see. Oh, good. Someone else is talking about that. Caitlin, I'm doing the same thing as a CNA my third semester. Pretty sure I'll be not working during my final semester. Jody, thank you. When you were training, did you get paid less than you were on your own? No. When I signed my thing that said I'm a nurse at this hospital, I was making this much. I think after 3 months probation, I got a small raise, and then after a year, I got a raise. So same, base rate is blank. That was in the state of Illinois. I can't speak for other states or countries or how that works, but that's how it worked for me. And if other nurses want to say what you get. Prince Harry, oh my gosh, I don't know who Prince Harry is dating. I don't know who Meghan Markle is, but now I've got to look it up. What's up, Lai? Okay. I would think you meant, what do you recommend doing? Do you recommend doing a nursing residency after finish my BSN? Yes, highly recommend new grad nurse residency programs. Absolutely. If you have the opportunity to do that, take it. Those hospitals that have those programs typically have much lower first-year turnover rates. Yes, do that. Did you ever fail a check-off on the first attempt, and if so, how did you manage to decrease stress? Failed a check-off. Oh, I can't remember. I did some, wasn't ready for things. But I don't know if I ever failed a check-off. Practicing, gosh, I don't know if I have good advice about that. I have my BSN. Sharon, I have my BSN. I don't know if I ever failed a check-off, but it can be pretty anxiety producing, but the more practice you can get, and not so much pressure on yourself because you're doing this like you're performing, right? You're like, oh, I'm trying to perform and show how much I know how to do, but really you're learning. This is a learning environment, and even as a new nurse, when I started working, it's like I had to do 5 IV, someone had to watch me start 5 IVs before I got checked off on it. I had to learn how to do blank. I had only started 1 Foley when I graduated nursing school. So, I had to practice that on a real person, So just remember, you are learning. This is not my one chance to show how to start an IV on this crappy mannequin. And everyone else is learning too. So I think if you can put it in perspective, I think that helps a lot. And if it helps, I'm sure I did fail one, but I've, 6 years out of school, and I don't remember if I did or not, if that kind of helps. I got hired in the tele unit. Oh, congratulations! Did we? I feel like we just did a little thing about working in a tele unit. I can't remember. But congratulations, that's a wonderful job as a new graduate. Rachel Zane from the show Suits. Oh, I don't know who that is, but the second I'm done with this, I'm gonna Google it. Donna. Got the same pay in Michigan, however, I couldn't do overtime while on orientation. I could not do overtime on orientation either. Okay, what do you think about going from an RN associate and going through your master's? Get it, girl. Do it. Do it. Whatever. You know what? If you want to do that, do it. They have direct entry master's programs. Some people feel very strongly about those, but honestly, those have tons and tons of clinical hours. Like, do whatever is best for you. If that's something you are interested in, get it. Do it. I'm going to hopefully start my master's this upcoming year. For me, though, doing the BSN straight away and getting that experience was helpful. Some people want to do their ADN, get some experience, get their BSN. It is all up to whatever works for you and your budget. And I just missed one. In the state of New York, nursing students are not allowed to practice IVs in school. I've heard multiple states. That is, yes, I have heard that before, which kind of sucks. We were told if the instructors ask for volunteers. Oh, yeah, that's good. Where or what resource do you like to use to continue to learn as you are working full-time to keep up and continue learning more? Depends on what I want to learn more about. I am a member of professional organizations, the ANA, American Nurses Association, and American Association of Critical Care Nurses. Those two have the best resources, I think. So when I want to learn more or want to look at this research study or whatever, I typically look at the journals that I get every month from them. And I read those, and if I'm interested in something else, I learn a lot on Twitter. I interact with a lot of nurses and healthcare professionals on Twitter, and I learn a lot from there. And I like to stay up to date on the news. So on my news app, I have like health filters, so I can have like the latest, articles come up from whatever places that are really cool to look at, like what's Cleveland Clinic doing and all that kind of stuff, to kind of stay in tune with what is happening. But it really depends on what I'm looking to learn about specifically. But social media is pretty cool with that. I'm on Tumblr, and there's a lot of good news on Tumblr and updates of studies and neuroscience, blah, blah, blah. So I just kind of use my professional organizations and my social media channels so that I get like the stuff that I want to see, if that makes sense. Great question, Jordan. I've been nursing for 33 years. Love that you do this live talk to young nurses. Oh, thanks, Donna. That's so cool. What's up? 33 years. I'm 50, so I don't have 30 years to waste. Oh, yeah. You know what, man? Go for it. If your budget can afford that and your time and the rest of your life you can do that, go for it. Like, no shame. Like, some people might say you shouldn't do that, but if that's what you want to do, do it. India. I am actually in my sophomore year of college and hopefully will be in nursing school soon, but is there any advice to give me? Check out the NRSNG blog, nrsng.com/blog. We have a ton of great blog posts. That's like the most loaded question. I feel like I could talk for hours on that. Check out our videos. We talk so much about advice for nursing students and even pre-nursing students. So check out our stuff. We love creating information for nursing students. If you're Canadian, some organizations at my university follow for breakfast. Oh yeah, great resources. Thank you, Brianna. RN in the Philippines watching. What's up? Thank you so much for tuning in from the Philippines. Can you recommend a nursing organization for telemetry? So the American Nurses Association is good. There is the American Association of Medical Surgical Nurses. And I don't know but that is the one that you would want to be in. If it's a regular telemetry floor, the American Association of Medical Surgical Nurses would be perfect for you, Vanessa. So I would check that out. And then when you work there for 2 years, get your certification. I think it's a MSCRN. I have my CCRN for critical care nursing. There is one for the med-surg nurse as well. Highly recommend getting that done after your 2 years. All right, y'all. Any more questions? Appreciate you guys all tuning in from the Philippines and Ontario, apparently. And all the great questions. These were really, really, really good. All right, guys, I'm going to sign off. Thank you so much. Oh, wait. Jordan said, absolutely love NRSNG. Everyone is great. Thank you for all your help. I just got my pocket scrub sheets. Oh, great. I would love to hear what you think about them. I think they're wonderful. So I hope those help with clinical. I think they'll be really great. So let me know what you think. What's the difference of the roles with a BSN and a nurse with an ADN? There is no difference in how you practice at the bedside. So, in some hospitals will pay the BSN prepared nurse more, some won't. There are studies over many years that show hospitals that have more BSN prepared nurses have lower mortality rates. So, the Institute of Medicine put out this charge for 80% of the nursing workforce to be bachelor prepared by 2020. So the job market is pretty competitive. A lot of hospitals are trying to accommodate that. So they're preferring BSN prepared nurses over ADNs. Or if you have an ADN, you have to have a plan for when you're going to get your BSN. So that is, I highly recommend starting out with a BSN if possible, or getting it pretty quickly. Have you thinking about teaching nursing school? Oh, great question. I'm probably going to get my master's in nursing education. Maybe at some point I'll be a professor, but I love doing this kind of stuff, a little bit more informal, but I really enjoy teaching. So what is a nurse residency program? So when you graduate and you start at a new hospital, typically you have a batch of new grads after, in August and in February, from the December grads and the May grads. And they all start together. And a lot of hospitals, because these residency programs are proven to have lower turnover rates, and turnover is very expensive for hospitals. So they institute these programs. And nurses in their first year of practice typically don't leave the profession as a higher rate if these programs aren't in. So you meet, whether it's weekly or monthly or whatever, with all the other new grads. You talk about what's going on, your experiences, your struggles, or like the one I went to every week. We met for 4 hours, and respiratory therapy came 1 week, physical therapy came 1 week, the hospice liaison came, and they talked, and some of the various leaders, and so that's kind of what it is. It's really to support new nurses during their first year, and they're wonderful and very, very helpful, because starting at a hospital is pretty overwhelming, so it's really, really helpful to acclimate to that environment. I have an application waiting or an update as a dermatological nurse. Wonderful. That'll be awesome. Is it okay to go from right from BSN to MSN? Yes, Candace. Get that MSN. Yeah, Jordan, I would love to hear that. Oh, and the pocket scrub. I think our pocket scrub sheets do not ship internationally right now. Sorry, guys. So, yes, I am a proponent. If you want to get an MSN for whatever step, go for it. That's a wonderful degree to have, whether or not you work at the bedside, and you can just do so much with an MSN. So I highly recommend getting that done if that's something you want to do. And there's a lot of affordable options out there, a lot of online options and whatnot. So, so a whole bunch of questions came in. So, all right, guys, well, have a wonderful night. Thank you guys for tuning in. It's been about an hour. So I'm going to turn on the election. We'll see how the night goes. All right, you guys have a wonderful night.